Hi there, I'm Dr. Katie Berry, one of the surgeons here at Veterinary Healthcare Associates, and today I'd like to talk to you about an exciting new technology that we're going to be offering here at VHA. Minimally invasive surgery is a broad term that encompasses many different procedures that we can do in animals. The ones we're going to talk about today involve the use of a camera in a body cavity or a joint. Some of the benefits to minimally invasive surgery include a smaller incision, which means less healing time. So those smaller incisions take less time to heal than a large incision that might be part of the whole body. Because of those smaller incisions, there's usually less pain as well. So these guys go back to function a lot sooner than a large abdominal surgery or chest surgery or things like that. Another benefit is since we're using cameras for the majority of this, it magnifies what we see versus what we're seeing with our human eyes. And so sometimes we can pick up on stuff that might have been missed with the traditional surgery. Some of the risks or downsides to this surgery include cost. Since we are using more technology to do this, cost is a little bit higher than the traditional approach. However, with the cameras, we see a magnified view, and so we might get a better idea of what's going on. And also, the benefits of less pain and decreased healing time really do outweigh that cost. Also, every patient is not a good candidate for this type of surgery. Some need to have a more traditional approach, depending on the organ or the disease type that we're looking at. And so we're happy to do a consult with you to discuss if your pet is a good candidate for this surgery. So now here at VHA, we have the ability to do several type of minimally invasive surgeries. The ones that we're going to start with are arthroscopy, and that involves using a camera to look in different joints of the body. The thing we most commonly think of is using it with the TPLO surgery for cranial cruciate ligament injury, and that's where we put the camera in to look at the cranial cruciate ligament and also address the meniscus if there's any issues with that. However, we can use this in all of the joints of the body. Some of the other common places that we can use this is in the elbow for elbow dysplasia, or in the shoulder, or some of the other joints for a condition known as OCD, which is a cartilage flap that can cause lameness. Also, we have the ability to look into the chest and the abdomen. That's called laparoscopy or thoracoscopy. And there's a lot of different procedures that we can do. Right now at VHA, we're going to start with elective surgeries like a laparoscopic spay and gastropexy. Those are great procedures for big dogs or older dogs that might be more difficult to do a traditional surgery. But really, any dog or cat can benefit from laparoscopic surgery because of those benefits that we discussed. In the chest, the most common procedure that we can perform right now is removing the pericardium from around the heart to treat a variety of diseases. But in the future, we can do things like remove lung lobes, ligate the thoracic duct, and also use it as a diagnostic procedure to look around the chest and make sure that what we're seeing is matching up with our other tests. In the future, we'll also offer things like foreign body removal, gallbladder removal, possibly removal of the adrenal gland. Those are more advanced procedures that need a little bit more training and also might need a little bit more workup than some of our traditional procedures. So a lot of times we will pair that with a CT scan that gives us a better idea of what's going on in the body, and that gives us a more structured approach when we're doing the surgery.